This is Adam Reuter reporting for Dundalk TV. Full disclosure, this is not the opinion of Dundalk TV. I'm simply reporting on a news story from the Florida Surgeon General. Let's zoom in on this letter to fill the screen up a little bit. I'm not going to be reading the entire letter. Everything will be linked below. Dear Doctors Califf and Cohen, ensuring that pharmaceutical products are both safe and effective for the public is the principal mission of the U.S. Food and Drug Administration. This function is essential and serves as the foundation for public trust in regulatory agencies and for health officials alike. While accelerated approvals for prescription drugs have been around for over 2 decades, the opioid crisis and COVID-19 pandemic are just 2 publicized examples illustrating the risks associated with these accelerated processes for drug approvals. On November 14, 2023, the Florida Public Health Integrity Committee met to discuss this topic, and I encourage your team to review the constructive criticism that will further our mission of credible and safe public health. I am writing to you to address the recent discovery of host cell DNA fragments within the Pfizer and Moderna COVID-19 mRNA vaccines. This raises concerns regarding the presence of nucleic acid contaminants in the approved Pfizer and Moderna COVID-19 mRNA vaccines, particularly in the presence of lipid nanoparticle complexes and simian virus 40 promoter enhancer DNA. Lipid nanoparticles are an efficient vehicle for delivery of the mRNA in the COVID-19 vaccines into human cells, and may therefore be an equally efficient vehicle for delivering contaminant DNA into human cells. The presence of SV40 promoter enhancer DNA may also pose a unique and heightened risk of DNA integration into host cells. DNA integration could theoretically impact a human's oncogenes, the genes which can transform a healthy cell into a cancerous cell. DNA integration may result in chromosomal instability. The guidance for industry discusses biodistribution of DNA vaccines and how such integration could affect unintended parts of the body, including blood, heart, brain, liver, kidney, bone marrow, ovaries, testes, lung, draining lymph nodes, spleen, the site of administration, and subcutaneous at injection site. So as you can see, the Surgeon General asked the FDA a few questions, asked for a response before December 13th. This letter was sent on December 6th. And now we're going to see the second part of this, which is the announcement on January 3rd, 2024. And that is, the Florida State Surgeon General has called for a halt in the use of COVID-19 mRNA vaccines. Now, in this press release, it's noted that in the year 2007, the FDA published guidance on regulatory limits for DNA vaccines in the Guidance for Industry, Considerations for Plasmid DNA Vaccines for Infectious Disease Indications. And in this guidance, the FDA outlines important considerations for vaccines that use novel methods of delivery regarding DNA integration. And as you can read on screen here, it's exactly what I just read. And right here it says, on December 14th, 2023, that's a day after they asked for a response, the FDA provided a written response providing no evidence that DNA integration assessments have been conducted to address risk outlined by the FDA themselves in the year 2007. And because the FDA has not provided any evidence that these risks have been assessed to ensure the safety of the public, the Florida State Surgeon General, Dr. Joseph, I believe his name's pronounced Ladapo, has released the following statement. The FDA's response does not provide data or evidence that the DNA integration assessments they recommended themselves have been performed. Instead, they point it to genotoxicity studies, which are inadequate assessments for DNA integration risk. In addition, they obfuscated the difference between the SV40 promoter enhancer and the SV40 protein, two elements that are distinct. DNA integration poses a unique and elevated risk to human health and to the integrity of the human genome, including the risk that DNA integrated into sperm or egg gametes could be passed on to offspring of mRNA COVID-19 vaccine recipients. If the risk of DNA integration have not been addressed for mRNA COVID-19 vaccines, these vaccines are not appropriate for use in human beings. Providers concerned about patient health risk associated with COVID-19 should prioritize patient access to non-mRNA COVID-19 vaccines and treatment. It is my hope that, in regard to COVID-19, the FDA will one day seriously consider its regulatory responsibility to protect human health, including the integrity of the human genome. In the spirit of transparency and scientific integrity, State Surgeon General Dr. Joseph A. Ladapo will continue to assess research surrounding these risks and provide updates to Floridians. So that's it. Like I said, I'm not going to give my opinion about this. I'm not even going to comment on it, other than to say, do your own research, check out the links below, and thank you for watching Dundalk TV.